want to know about this work group. I'm just going to record this section of the conversation. So I just want to give a brief overview of the past work that IAPO has done in kind of these realms. This is the first time, this is a new working group. So we haven't done anything under this umbrella in the past, but we have had grant work and work that has kind of fallen under what would be this working group. So I'll go over all of that and then the framework goals that we've established and the strategies that fall under those goals. So the work that's most closely related to this new work group in the past focused on clinical community linkages that promote healthy lifestyles. Early IAPO advocacy to affirm the Medicaid benefit of pediatric weight counseling in Illinois. And in 2016, we began exploring options for Medicaid coverage of diabetes and chronic disease prevention and management programs. So work that fell under that included we supported statewide partner engagement and planning. We developed the roadmap to coverage for diabetes prevention and management, and we supported pilot programs and engagement with state leaders and payers. The early work of this work group is what led IPHI to have the partnerships and expertise in place to apply for the CDC 1817 cooperative agreement, which became the Chicago Cares Initiative. And you can see the key strategies of that grant here on this slide. The 6 strategies of that grant that we've had to work on. But essentially, the work that came out of this grant was to expand access to the National Diabetes Prevention Program, Lifestyle Change Program. That's what Annalisa was referring to as the DPP, the Diabetes Prevention Program, in Chicago priority communities. And since 2018, we've also partnered with IDPH on their CDC 1815 grant to help advocate for and implement Medicaid coverage of the National Diabetes Prevention Program and diabetes self-management education and support services in Illinois. So both the TPP and DSMES have been fully covered in Illinois, and this came into effect on August 2021.
I didn't realize that was so recent. Because I just kind of joined this, hopped on this, the diabetes realm, if you will, more actively in the last year. I had no idea this was so recent. Wow.
Well, it took a few years, as most things that come into law do. Yeah.
Wow. Good deal.
So this is new opportunities and new work that we're embarking on that can fall under this work group. So that includes the CDC 2320 cooperative agreement that I mentioned that started June 30th of this year. It's a 5-year cooperative agreement, and it connects to funding opportunities that advance the National DPP, Lifestyle Change Program, access to DSMES, development of new referral systems and partner connections to improve access to the National DPP, support statewide and regional planning for implementing, spreading, and sustaining an evidence-based family-centered childhood obesity intervention. So all of this is under the 2320 cooperative agreement, and advocating for implementation of statewide systems that support and sustain healthy lifestyle programs, including QI measures, improvements in coverage, provider network enhancements. So now we're going to jump to, through all of these planning meetings, we've established 2 goals that fall under the healthy lifestyle programs and systems. Are you seeing the goals? I'm getting a little alert from Zoom.
Yes.
Okay, good.
We can see the slide.
Thank you. I'm like, I don't know what this means, but I'll ignore it.
I don't see what you're seeing. We don't see what you're
good,
seeing.
good.
Yeah.
Glad. So the first goal is to increase awareness and implementation of the Preventive Service Task Force recommendations for screening and referral, as well as knowledge of available diabetes prevention and management programs to healthcare systems, providers, pharmacies, school-based health centers, CHWs, and more. Some of the strategies that fall under this goal include develop state quality measures for diabetes prevention and management that incentivize screening and referring to intervention, Improve referrals to the national DPP and DSMES through the development of a centralized referral system, umbrella hub relationships that support referrals, and or through connection with existing community education, CHW-led education and referral initiatives. Educated health systems and providers on the importance of developing and or implementing policies, providers on the importance of developing and or implementing policies, processes, and tools that support alignment with diabetes prevention and treatment standards of care. Improve coordination between NDPP, DSMS, and medical nutrition therapy programs and providers to ensure people are referred to the right program that best meets their needs, and increase the number of NDPP and DSMS providers enrolled in both Illinois Medicaid and Medicare for those services. You can see luckily our group that helped establish these strategies came from all walks of the public health world, so in healthcare world. So you can see like a lot of different voices helped establish these strategies. And the second goal is to eliminate barriers to participation in diabetes prevention and management programs by ensuring participants' social needs are met, including transportation, childcare, access to culturally relevant and nourishing foods. So the strategies under these goals include seek health plan coverage for healthy family weight programs and other evidence-based diabetes prevention and management services beyond the national DPP and DSMES, support healthy food prescription food as medicine programs as a Medicaid covered benefit, and increase access to NDPP and DSMES providers who offer programming in person, virtually, or via telehealth. So now I can stop the recording because now we're just going to be talking.